Until the early 1990s, Asia remained relatively unaffected by the HIV epidemic. But by the turn of the century, it had spread rapidly in many population groups in the region. Income inequalities, displacement, mobility, migration, stigma, the low status of women, and the lack of sexual and reproductive health education are all factors that make Asia vulnerable to HIV. And while HIV prevalence among the general population in Asia often remains below 1%, this small percentage represents about 5 million adults and children in the Asia-Pacific living with HIV. In 2007 alone, about 380,000 people were infected with HIV, while the same estimated number died of AIDS. The infection is mainly spread within population groups engaging in high-risk behavior, like sex workers and their clients, men who have sex with men, and injecting drug users.
As far as our understanding goes, most of the Southeast Asian countries are driven by injecting drug use. And it's the same for Indonesia. It's more or less the same for Thailand. It's more or less the same for Vietnam. Parts of India in the northeastern part is more or less the same as the rest of the Southeast Asian countries. So we're looking at a kind of a concentrated epidemic, as also pointed out by the CAA the Commission on AIDS in Asia recommendations, that the Asian epidemic is concentrated in the key affected population.
ในกลุ่มผู้ใช้ยาผมคิดว่า HIV น่าจะได้รับข้อมูลกันเป็นส่วนใหญ่เพราะทั้งทางรัฐบาลทั้งทีวีอะไรมีประกาศออกมาแต่ยังไม่ครอบคลุมเสียทีเดียวนะครับแต่ถ้าตับอักเสบซีน้อยมากถ้าไม่ได้เข้ามาในศูนย์นี้ผมยังไม่รู้จักตับอักเสบซีเลยว่ามันคืออะไรแล้วมันอยู่ใกล้ตัวเราแค่นี้เองแล้วมันติดง่ายกว่า HIV มากสำหรับผู้ใช้เข็มทำไมต้องใช้เข็มใหม่ทุกครั้ง
Men engaging in high-risk behavior often have female sexual partners who in turn become infected. In many Asian countries, females represent 20 to 30% of the people living with HIV.
People who use drugs are the most high-risk group, but now the pandemic seems to integrate in the general population. Like for the women group that I'm working with, most of them there's no drug user in there, but most of them they live in the countryside and they have never been to the city, but then they still got infected. And I think the number is increasing because their husband, maybe they are migrant worker, and then they went to the city to earn money, and then it's very easy for them to get involved in drug abuse or prostitution.
HIV-positive mothers may transmit their infection to their baby in about 25% of cases. This is why, at the end of 2007, about 150,000 children were estimated to live with HIV in Asia. Prevention programs need to target the population groups in which the new infections are likely to occur. There is a need to understand the dynamics of HIV infections. Programs, such as the Siloam Clinic for Men in Bangkok, need accurate data to effectively prevent new infections.
We provide services only for male in this clinic, and we have a unique card. This is clinic card, no name, no information, and only clinic ID. In this clinic, we have two activities. One is to provide HIV and STI service, testing service anonymously, and the other one is we do research. So the data is important in both parts. For the service, when you provide service, you want to evaluate if your service has reached your goal or has been success or not. So the data is important.
We have a serious gap in information on men who have sex with men. I think because they're stigmatized in Asia. In many countries, anal sex is a criminal activity, and a lot of the projections now predict that this will be the next wave of new infections in the Asian region because this group has been neglected for so long.
ส่วนใหญ่เราทำในเรื่องของถ้าเรื่องของข้อมูลเนี่ยค่ะเป็นข้อมูลที่สมาชิกของเรามาเล่าให้เราฟังเป็นข้อมูลที่ได้จากการแลกเปลี่ยนเวลาเราจะมีการประชุมแลกเปลี่ยนเพราะว่าเรามีกิจกรรมศูนย์เพื่อนที่ไว้แลกเปลี่ยนความคิดเห็นซึ่งกันและกันหรือว่าแลกเปลี่ยนกิจกรรมแลกเปลี่ยนประสบการณ์เนี่ยค่ะเราก็จะได้ข้อมูลจากตรงนั้นเนี่ยส่วนหนึ่งแล้วก็แต่ว่าเรื่องของผู้ติดเชื้อเนี่ยเราพูดตรงๆว่าสมาคมเองไม่ได้ทำงานในเรื่องของการเฮลท์แคร์ค่ะแต่ว่าเป็นเรื่องของการไม่ได้ทำเรื่องของทรีทเมนต์แต่เป็นเรื่องของการที่ prevention ก่อนที่จะถึง
That is our dream, that we hope that prevention should be more important than cure. For the treatment, it might be easier to see. For example, like you have 10 sick people, if you can cure 9 of them, then you did a good job. But for prevention, it's very difficult to see. But actually, I believe in prevention, and I think that the government should pay more attention or allocate more budget on the prevention.
When we look at the many data, we saw some signs that if we don't do anything about prevention more than right now, we are going to be in trouble. Among 6,000 million baht for HIV programs, only 14% for prevention.
But what